I'm Laura Welsh, and I'm the Community Outreach Manager for California and Oregon for Nuclear Care Partners Home Health Care.
Okay, so what is Nuclear Care Partners? I feel like so many people don't know about this secret benefit.
It is a secret benefit.
Yes.
It's a very niche market. It's a home health care company, but it's only for former atomic workers who used to work either in the Manhattan Project, those are old timers, or in the atomic labs themselves and the support system around the atomic industry. So there's about 330 different sites throughout the U.S. where if a worker becomes sick with a debilitating disease or a cancer, they can file for a benefit, and we take care of those folks who have that benefit.
Wow. And so just here locally, what are some key, like Lawrence Livermore Lab, give me a rundown of what we can expect to folks in this Tri-Valley area. If you work here, because I remember we were having a conversation once and you were like, even if they were the maintenance guy.
Even if they were the maintenance guy, even if they were the guy that delivers Pepsi-Cola to the sites in the vending machines, if they come down with an illness, it can be traced back to either radiation or toxic chemicals. They can potentially be eligible. So we're talking in this area, Lawrence Livermore Lab, Sandia Lab, Lawrence Berkeley Lab, over across the bay, Stanford Linear Accelerator, and over hidden in the mountains over in Pleasanton, GE Valicitos.
What goes on at GE Valicitos? Is that General Electric Valicitos?
Yes. I think it's owned by a Hitachi now or somebody else. But they used to be involved in either making or testing components for our nuclear arsenal. I could tell you what goes on over there, but somebody would come.
We don't want the men in black showing up. That's for sure. Okay, so anyone that's had contact with those sites primarily, and the benefit is pretty significant, right?
Yeah, not only are they eligible for a monetary payout, they're also eligible for free medical benefits paid for 100% for the rest of their life for that covered condition. And the monetary benefit can be up to $400,000, and that's tax-free money in their pocket.
Wow. So they can pay the $40 an hour for in-home care support.
They don't have to, because if they're eligible for in-home care, that's what my company does. And we're paid directly by the Department of Labor because that's who manages the benefit. So they don't have to pay any money to me or to my company.
Wow. Okay. So they would also get the benefit and you guys would take care of them. So are you contracted with the other in-home care agencies, or you guys have your own team? How does that work?
We are a home health agency.
So
we have our own nurses, we have our own home health aides, and we pay them on W-2, so they're not contractors. They go through a full vetting process and fingerprinting and background checks and everything before we put anybody into the home.
And so what are the medical conditions that you're most seeing that are qualifying folks that have been?
Yeah, around here I see a lot of cancers, of course, because there is a lot of radiation exposure, a lot of multiple myeloma and Hodgkin's disease. We're seeing much more Parkinson's disease lately too. And Parkinson's is one of those weird illnesses where it all depends on what job they did at the site, whether they're going to be covered for Parkinson's. So if they had a heavy solvent exposure, heavy metal exposure, things like welding, manganese exposure, and they have Parkinson's, chances are they'll probably be approved. But if they work behind a desk like a secretary, probably not. We'd have to dig really hard.
And so where did this benefit derive from? Was there a lawsuit? Is this like an Aaron Brockovich situation? Where is this free money coming from?
The free money is coming from our U.S. government. And it turns out in I want to say in the 70s, 80s, 90s, folks were starting to get cancers. And they started talking to their congresspeople. And the congressman went up to Washington and made a bill and decided to compensate all these people whose only thing that tied them together was, they all worked on the Manhattan Project.
Wow.
So there was a commonality. So I think President Clinton signed it into law. It went into effect in the year 2000 to compensate folks with certain radiogenic cancers $150,000 in their pocket, plus free medical benefits for those covered conditions for the rest of their life. And then 4 years later, the toxic chemical exposure bill was also added to that. And that added up to $250,000 more, plus wage loss and impairment ratings. So every 2 years, they get another rating on their body, how their illness has affected their body, and they can get a chunk of that $250,000 until they cap out.
Okay, yeah, much like workers' comp, they have their own, right?
Yeah, it's a hybrid between the workers' comp and Department of Energy, Department of Labor. So Department of Energy employees are eligible. Department of Labor, the workers' comp division, manages this.
Got it. And then how come more people don't know about your guys' services?
Government doesn't do a real good job telling people things.
Yeah.
It comes down to folks in the field like me, educating caregivers and educating care homes. And I have a lot of town hall meetings and breakfast. And yesterday we had our National Day of Remembrance for former atomic workers. And we are lucky to have at least 120 people show up. And word of mouth spreads really quickly too.
Yeah. Okay. So I would have automatically thought, of course, these people are probably getting a pension from wherever they worked at some point.
They do.
They're in some type of communication. I would think that they would say, hey, call this company. You should be tapping into this benefit.
Giving these employers the benefit of the doubt. I think at the time of work separation, they probably are given something.
Okay.
But by the time some of these illnesses are so insidious, they incubate for a long time and they pop up 25 years after they've separated from employment. So they don't remember, they don't know, or they've moved out of the area and maybe they've been lost track of. It's not a really good system. Everybody knows about coal miners, right? Everybody knows about the black lung disease and they get a benefit. It's operated by the same Department of Labor department.
Got it. Okay.
It's crazy.
Now, these sites are safe today, right? So if people...
No, they're not.
Okay, so they're not to this day.
They really... they are as safe as anything can possibly be when you're working with highly toxic chemicals and highly insidious radiation. I think personal protective equipment is a lot better these days. Okay. I have pictures from the 1940s with the guys working in their shirt sleeves, looking at the stuff. And they didn't know back then, which is why they have this benefit now, because for a long time they didn't know. And they were learning as they were working, and they were learning, a paper bag is not going to insulate me from the effects of radiation. And they used to wash their hands with solvents, really bad solvents that are outlawed today.
Wow. So tell me about the Day of Remembrance. How did that go yesterday?
The Day of Remembrance was wonderful. We had it at Ravenswood in Livermore and had a nice little catered buffet luncheon spread. We were able to honor our very first patient that we ever signed. We've been around since 2011.
Wow. Okay.
And actually, my company is based in Colorado, but we're now in 24 states. And California was the state they started in with our founders. They were new mothers. They were 2 nurses. They had babies on each hip. And they pounded the pavement everywhere. And they found this nice gentleman who is always dressed to the nines whenever we see him. And they signed him on. And he's still alive today. We still take care of him. He's very special to us. So we honored him yesterday.
Fantastic. So did these ladies who started the Nuclear Care Partners, did they have husbands that were affected by?
No, they used to work for a similar company in New Mexico.
Okay.
And they left that company and said, you know what? I think we could do this a little bit better. And they started very small. Their goal was, we just want to change the lives of 10 people and bring jobs to certain areas.
Yeah.
And every time we get a patient, we're bringing jobs as well. So they had a well-rounded business approach, but they didn't know how to execute it. They love to tell the story. The first outreach they had, nobody came because nobody knew. Yeah. Nobody heard about them. They were passing out flyers on Livermore Avenue and Front Street or First Street. And yeah, it was a bomb, but they persisted, and they had this little minivan they were driving around, and they're good nurses. They're nurses that will roll up their sleeves, even though they're the presidents of the company, to go and help the patient.
Wow.
One of the nurses has since left. She has an interesting story in and of herself. Her son's a pro golfer, and she's going to go on tour with him.
Yeah, nice.
But our original founder is still there, and she is the sweetest, most driving force that I've ever worked with, and she's wonderful.
Wow.
We are inspired by her every day. Her name is Jenna Nome.
Wow.
And she's a young woman, and now she's got 5 kids.
Wow.
And I remember the first time I met her, I started in 2015, and she was pregnant with one of them.
Yeah.
And I don't know how she does it.
Wow. That's pretty incredible. Yeah. To have a thriving business and 5 kids. I know. I am only able to be this much out there and doing all of the things. Everyone's like, how do you have the energy? And I'm like, because my kids drive now.
Exactly. The kids leave me alone.
Yeah. I don't have to be Uber for the kids.
All I have to do is give them money.
Yeah, exactly. So it works out. So tell me, how long can families expect to wait for this benefit?
It varies. There are some cancers, there's 22 specified cancers that if they worked during a particular time at sites that have a special, let's say, dispensation, it's called a special exposure cohort. During this time and this time.
What are we seeing in Livermore, since we're closest to Livermore?
So, and anybody who's worked at least 1 year prior to 1989 at Livermore Lab, or prior to 1994, the end of 1994 at Sandia, they have one of these 22 specialized cancers, from brain to bladder, internal cancers. It can go as easy as 2 months.
Okay.
Or
a lot
it could
easier
go
than
longer. Yeah.
A lot easier than sometimes working with veteran aid and attendance and getting your benefits through to that side of the tower.
The lucky ones who get one of these cancers, and don't say that with any disrespect, can get their money and their care within about 2.5 months. The kicker is if they have, let's say, a prostate cancer, which isn't one of those cancers, it all depends on what their work duties were, what they were exposed to, and then they have to go through what's called a dose reconstruction at the National Institute of Occupational Safety and Health, NIOSH, and pull the old dosimeter records, the old things that used to measure their radiation doses. They see what their work history looks like, what they were exposed to in what areas. And then they magically do an algorithm and figure out if it's as least as likely than not caused by their radiation exposure.
Yeah.
And then people like I said, Parkinson's disease or anything like that, kidney disease, it all depends on where they worked and what they were
doing at the time.
And that could take several months.
Yeah. Okay. So how can we help you get the word out? Other than posting on social media, who are some demographics that we should be hitting with this information?
Generally men over the age of 60.
Okay.
Or their children who are faced with the prospect of having to care for mom or dad. Those are the 2 groups that I reach out to.
Yep.
There's women also who are exposed and who qualify, but I would say at least 80% of the folks out there, because back in the 40s, 50s, 60s, the men were doing the hard work, and hands dirty work, and the women were in the office. Office people got sick too. And luckily, if they worked between those dates, they get benefits too.
Okay.
And if somebody has passed away but still worked there are survivor benefits available too, depending on what their disease was when they died, when they worked, things like that. And I can help them connect those dots as well.
Wow. Well, that's pretty incredible, because it is so hard to, with any illness, whether it's a dementia or Parkinson's or a cancer, it can be pretty costly. It can bankrupt families.
Yeah. I remember I was paying $20,000 a month to keep my mother-in-law in a memory care in the Tri-Valley. $20,000 a month. Who has that?
What year was that?
That was 5 years ago.
Yeah. Yeah.
I can't even imagine what it is now.
If you are in memory care and you need 24/7 standby assistance,
that's what
you're easily probably paying about $27 right now.
Oh my gosh.
You can pay half of that in a residential care home, but sometimes families just want all of the other bells and whistles of the larger community setting. So it just really depends. But even to age in place, as most people want to do, they want to die in their homes. They want to age in place.
Exactly right.
It is expensive. Most home care agencies are charging $35 to $40 an hour.
Yeah. And we can work with hospice and home care agencies if they have disease processes other than what they're approved for under the Department of Labor. And let's say they have bladder cancer and they're getting treatment for bladder cancer, but they also have dementia.
Yep.
They're not going to be approved for the dementia, but they're going to be approved for the bladder cancer. So we can offset some of that care need to them while they're still paying out of pocket maybe for the other overnight care for dementia and everything. But at least it cuts down the cost for the family or the husband or wife.
Yeah. That's pretty incredible.
And we work with hospice too.
Yes.
Hospice goes in, usually paid by Medicare. We go in and fill all those gaps that hospice cannot fill because staffing is at a premium nowadays. Yeah. And lo and behold, the person can have 24-hour care for nothing.
Yeah. Yeah. That is an incredible benefit. And a lot of families do think that hospice means, oh, okay, we're going to have a caregiver here. Well, not exactly. You're going to have someone, a CNA, come help with showers and a nurse come check in
once a week.
That's pretty much it. Yeah. So you definitely have to be prepared. And I think there's one home care with Hospice of the East Bay, Bruns House. And then I know there's another, it's not Bruns House, it's another agency out in Tracy. And then there's one in San Francisco. If you need 24/7 care,
there's inpatient units in hospitals, but sometimes those are prohibitive because the patient doesn't want to be in a clinical setting.
Yeah.
As nice as those inpatient units are, you're still in the hospital.
Yeah.
And sometimes families balk at that. I came from doing hospice for 12 years before I started with Nuclear Care Partners.
Oh, so this is an easy transition for you.
Yeah.
Yeah.
It's easier on my heart and my soul too.
Yeah.
Because I don't have the everyday losing somebody. I still lose people.
Yeah.
But they stay with us longer because these are chronic diseases. So we expect them to decline, but we don't expect them to immediately decline and pass.
Yeah. Yeah. And you're coming with, here's money on the table.
And sometimes it's life-changing monies for these families. We think of Livermore Lab, they're scientists, they're highly educated. Yes, they are. However, the laborers who came here to find a job, who stayed in Livermore and are eking out an existence, and then they get sick with nothing in the bank, $150,000 in their pocket, can put a new roof on, can feed their family a little bit. Another 250 more can leave a legacy for the people left behind.
Yeah. Do you have any stories of how you guys have come in and changed the trajectory of someone's life?
I was just thinking of him as I was telling that story. A painter. He was a painter, and he was a man who lived in Modesto, and he was the sweetest man. And he didn't believe it. A lot of people don't believe, and they think this is a whole scam.
I tell you, and I'm like, what? You guys are getting...
Even the new people yesterday who came to National Day of Remembrance is like, where do we pay? It's free.
Yeah.
But this is a nice spread. It's like, oh, this is our way of giving back to you. So he had a cancer that spread all over the place, and he was the sweetest man. And I was talking with his son, also named the same as this gentleman, and his son actually worked at Sandia. And so he did the research behind Dad's back. No, Dad, this is okay. And I worked him through the system. We got him paid. We took care of him for a while until he passed.
Wow.
And he wrote me the sweetest note. He says, thank you. My roof blew off last summer, and it's been being held in a tarp, and you gave me the wherewithal to take care of my roof and have something left over for my family.
Oh, wow. What a blessing.
Yeah.
What a blessing. That's incredible.
Yeah.
Is there anything else that I haven't asked you that I should be asking you?
How do you contact me?
Oh, yes.
So how do you contact me?
So how does folks get a hold of Nuclear Care Partners?
To get a hold of me directly, and I answer my phone because it's like a bad penny. It stays with me all the time. I'm at 209-597-0887. If you want the home office, it's 888-525-5111. And if you want to send me a nice little email, it's Welsh. That's LWELSH at nuclearcarepartners.com.
Perfect. And then is there a website, Nuclear Care Partners?
nuclearcarepartners.com. Yeah, go check out the website. You can see our founder and some stories of the patients that we've served and some of the new initiatives that we're doing, like taking care of dialysis patients and lung patients especially.
Wow.
Yeah, we're the only company in this area that's accredited for this population that has special programs for chronic disease and who really care about their patients.
Yeah. Do they get any other special like cutting edge treatments access, or I don't know?
I have a gentleman today. I was just looking in an email before I came here. He has almost 5 kidney disease. So he wants to have a transplant, and he's a Kaiser patient, but he doesn't want to go through Kaiser. And because of this benefit, he can go to the Mayo Clinic. He can go to Stanford. He can go to wherever he wants to for this treatment.
Wow.
And that's the nice thing.
Yeah, that's pretty incredible.
Yeah.
Gosh. Thank you for coming and sharing. I appreciate
Thank you, Christine. I appreciate it. You do wonderful work.
Thank
and
you.
I'm so glad to be a community partner of yours.
Love it.